We've got a lot of stuff to talk about, including vaccines for children as young as 6 months old. Do you agree with it, or do you think 6 months old is just a little too young? Well, on the line right now to talk about why your child should possibly get it or maybe why they shouldn't get it, it's an infectious disease doctor from Akron Children's Hospital, Dr. Eric Robinette. Doctor, how are you this morning?
I'm doing great. How are you today?
I'm doing well. Thanks for taking time out of your Tuesday morning. I know you're very busy, so we appreciate it. With the FDA, the Food and Drug Administration, on Friday authorizing these COVID-19 vaccines for young children, what does this mean in the progress that we're making in the COVID response over 2 years later?
Well, I think it's just a natural continuation of the process that we try to go through with vaccines. There's a lot of reasons that, vaccines are easier to study in adults. And also, it's clear that with COVID, the very highest risk age groups are in elderly adults. And so we started with the people that were at the highest risk and in whom we could get practical studies. And then it takes time usually to work your way down to the younger children because we want to make sure that we're using the right dose and that we're being very conscientious about our safety testing. And so, this is actually pretty fast compared to a lot of vaccine developments in terms of how hard they've worked to do it the right way in a relatively short period of time. But I think it's just a natural extension of the progress we've been making.
That's what a lot of people are concerned about, Doctor, is how fast these COVID-19 vaccines are being created, authorized, approved. Should anybody be concerned about, the FDA or the CDC or whoever's formulating it, Pfizer, Moderna, should anybody be concerned that there are steps that are being skipped right now?
No, they really haven't skipped any steps. They really have. They developed the vaccines quickly through a couple things. So one is none of this happened by accident. So after the first SARS-1 near miss of a pandemic, the National Institute of Allergy and Immunology and other groups have spent several decades trying to figure out how to develop vaccines faster. So some of this was developed with intentionality. And the other piece of it is mostly the way that they've accelerated the vaccine development has been through doing, spending a lot of money, quite frankly, and doing things that they might normally do in sequence in parallel. It's not a less safe or a worse way to do it. It's just a more expensive way to do it, but it gets you something faster. And, we knew that a lot of people's lives were at risk from this pandemic, and so it made sense to invest the resources to do it as quickly as we could.
One thing that I noticed after all of this was authorized by the FDA is that Pfizer's vaccine was authorized for children ages 6 months old to 4 years old, while Moderna's vaccine was authorized for children 6 months old to 5 years old. Why, do you know why Pfizer only stopped at 4 years old and Moderna got to go to 5 years old?
Well, I think the main reason was that Pfizer already had an approval for a different dose of vaccine for 5 and up, and so they really didn't need an approval for 5 years old. And so I think it just came down to, there's some work to be done always to try to understand what's the right dose for the right age, and I think Moderna and Pfizer just used slightly different age cut points for where they changed their dose.
Okay. All right. I understand that then. So I appreciate the clarification with that one. Now, what about the dosage? Is this going to be a lesser dose? Or is it going to be like a two dose set like we were getting with Pfizer and Moderna, or is this going to be a one shot and the child is done?
Yeah. So the Moderna is a 2-dose series. And it is a smaller dose, so it's about a quarter of the adult dose. And then Pfizer is a 3-dose series. It's also a lower dose. It's about a tenth of the adult dose. So both companies worked on lower doses given, obviously the smaller size of the younger children. And then Pfizer's is a 3-dose series because they found that they got much better efficacy, particularly against Omicron, but also overall with a 3-dose series.
And Dr. Robinette, I want to get your opinion on this. We've heard a lot Well, our kids, if they get COVID, they'll be fine. They'll be fine. They don't need the vaccine. They don't need to wear masks. They can still be around everyone. Why, in your professional opinion, is it still important for children to get vaccinated against this virus?
Well, so the 1 to 6 months to four, say 4 or 5-year-olds are actually the one of the highest risk age groups among children, right? So obviously, elderly adults are massively higher risk compared to everybody else, but these kids are actually higher risk than the older kids. And what's most interesting is that they're the group where healthy kids are the highest risk of getting sick. So among adolescents are the highest risk of having hospitalizations and emergency department visits and things like that, but it's usually adolescents with other medical problems, whereas it's largely healthy children under 5 that have complications from COVID. And, I don't want to overstate the case. I mean, most children under 5 who get COVID do well. The vast majority do well, but on the scale of unacceptable serious outcomes for some children compared to other vaccine-preventable diseases, COVID compares quite reasonably, right? So this past winter, there were more hospitalizations and deaths for COVID than there were for the last couple of flu seasons in this age group, right? And so certainly far higher rates of complications than a number of other vaccine-preventable diseases in the first year before the vaccine was rolled out. So the risk-benefit is still very favorable, meaning that the benefit of getting the vaccine still far exceeds the risk of getting the vaccine, even though, the majority of kids that have COVID don't have a serious complication.
All right. Now, I'm very glad, Doctor, that you're able to explain that, because I've had some calls from our listeners that say, I'm on the edge. I don't know if I would vaccinate my 6-month-old. That's what a lot of people, that's the only thing they hear when they hear of the age range with this is, oh, man, 6 months old, 6 months old. Would you vaccinate your 6-month-old child, Doctor, if you were able to?
It's funny that you asked that. My son is actually 6 months old, and his mom got vaccinated while she was pregnant, and I fully intend to take him and get him vaccinated once we have some appointments available. So yes, we have a long history of vaccinating infants and young children for various infectious diseases. Actually, most of the vaccines are given in the first year of life. And the reason is because the kids are the most vulnerable to serious complications of infection in the early years of their lives. And so that's when vaccination gives us the most benefit. And the same is true of COVID vaccination when we're talking about kids. These are the most vulnerable children, the most vulnerable healthy children, let's say, to COVID. And so the reason we vaccinate them so young is because that's when we need to protect them.
Okay, wonderful, wonderful. Now you're saying that the vaccine, people should vaccinate their children instead of giving them ivermectin, right?
Yeah. The ivermectin is not safe for that indication and not effective, and the vaccine obviously is much safer and can prevent COVID.
I have to ask all my doctors that, because I've gotten calls before from people that say, I'm just getting the ivermectin, a couple doses of ivermectin, I'll be okay. So I always like to ask the doctors I have on the show their professional opinion on that one, and it's crazy because you guys all say the same thing.
One of the things that maybe people don't appreciate that aren't in our business is that it's actually profoundly difficult to treat viral infections. They replicate so quickly and they make you sick so quickly. And the number of drugs that we have available to treat them are so limited that it's just very difficult. It's quite rare that we develop a drug that's very effective against viral infections. So nobody was surprised that the antivirals have proven difficult for COVID. Obviously, we'd love to have a great treatment for COVID as well as a vaccine, but it's just a difficult problem.
All right, wonderful. Dr. Eric Robinette, we appreciate you coming on today, sir.
My pleasure.